Welcome everyone to today's webinar, How Cedars-Sinai Hires and Retains Nurses. On behalf of Becker's Healthcare, thank you so much for joining us today. Before we begin, I'll walk through a few quick housekeeping instructions. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded, and it will be available after the event. You can use the same link that you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. With that, I'm so pleased to welcome today's speakers, David Marshall, DNP, Senior Vice President and Chief Nursing Executive of Cedars-Sinai. Dr. Marshall has more than 3 decades of nursing leadership experience, and prior to joining Cedars-Sinai, served as System Chief Nursing and Patient Care Services Executive for the University of Texas Medical Branch at Galveston, where he worked for over 30 years. We also have with us today Iman Abu-Zaid, co-founder and CEO of Incredible Health. A medical doctor by training, she is the co-founder of Incredible Health, which is a hiring marketplace for nurses and health systems. Incredible Health's custom matching algorithms allow health systems to hire permanent nurses in 20 days or less. David and Iman, thank you so much for being here today. Unfortunately, Jeffrey Smith is unable to join us. Iman, I'll now turn the floor over to you.
Thank you so much for the introduction. Appreciate it. The other thing I wanted to mention is Cedars-Sinai was recently ranked number 6 on the U.S. News Best Hospitals Honor Roll for 2021 and 2022. And they also have 5 successive Magnet Awards so far. And they're one of only 10 hospitals nationwide to do that and to achieve that. David, thank you so much for your time. Really, thanks so much for being here with us today.
Thank you. It's my pleasure to be here.
Great. So here's our agenda today. So we're going to be covering nurse hiring and retention at Cedars-Sinai. We're going to start with a brief overview of today's nurse labor market. Then we're going to cover the topic of nurse retention, including how David thinks about nurse compensation and scheduling, how his teams create a positive work environment, and how to build a culture of technology and innovation. And then we're going to move into the topic of nurse hiring, and where we'll talk through how to hire nurses effectively in permanent roles, and how Incredible Health helps as well. With that, at the end, we will definitely have time for Q&A. So as mentioned, please feel free to submit your questions throughout this webinar, and we'll make sure to allocate a lot of time to answering your questions too. Okay, so let's start with an overview of the market. So let's set the stage of where we all are and what we're dealing with today. So our demand for healthcare as a country keeps going up, right? Our population is aging. That continues to put more and more strain on the healthcare system. Of course, things like COVID don't help, right? Those are demand shocks on our healthcare system. But we simply do not have enough workers, healthcare workers, to meet that demand. Currently, 1 in 8 Americans works in healthcare. It is the biggest labor sector in the country by number of workers and by dollars spent on the workers. And since 2018, it's been the #1 employment sector in the US as well. Now, the problem with this shortage is getting worse, and it's impacting us in various ways. So first, we're on track to be 1 million nurses short by 2023. That means this country is missing 1 million nurses that we actually need, on top of the nurses we already have, in order to fill the demand from patients. The second thing is we are also experiencing unprecedented levels of turnover, including among acute care nurses. Before the pandemic, it was 17.5%. In 2021, it increased to 21.5%. Our latest data shows it's roughly about 19%, and that's our national average. We know that Cedars-Sinai is doing a lot better than this. We also have teams that we work with that are not doing as well with this, but that's the national average right now. Third is the labor is getting more expensive. On average, health systems are spending 48% of their revenue on labor. There are some teams where it's higher. It's in the low 50s, and that is also increasing. We are expected to see increasing wage inflation among permanent nurses as well over the next 12 to 24 months too. And so it's important to understand that these labor costs are going up, not just among the temporary workers, like the travel nurses and so on, but even our permanent workforce is getting more expensive as we need to, provide more incentives and increase their salaries as well. And we'll talk through that in detail as well with David. And then the fourth piece is our time to hire continues to increase. Right now, it's taking on average 82 days to fill a permanent and specialized staff nurse role at an acute care facility. Now, for some, it'll be shorter than that. For new graduates, it's certainly quicker than that. But if you want a specialized nurse in the U.S. today, it's taking on average about 80 days in terms of time to fill. All right, so let's dive into, well, actually, before we dive into the nurse retention, David, we did want to ask, like, what have you seen in terms of your nurse turnover, and particularly with our most recent Omicron surge?
Yeah, we definitely saw an increase in the last quarter of the calendar year in our turnover. And luckily, we aren't at that 19% average that's across the nation, but we have crept up higher than we've been before. We've seen higher patient volumes, not only COVID patients, but patients requiring just general medical care. I think we're seeing 100 patients more on average per day than we were seeing 2 years ago, but that includes our COVID. We've also decreased the number of surgeries that we've been able to do. So we have a backlog that we anticipate will keep our volumes high for the next foreseeable future anyway. I don't know how long it will last. And then, the Omicron surge was different because it impacted our healthcare workforce more than the previous surges. We saw a dramatic increase in the number of our employees who tested positive throughout December, and that started coming down early in January. So we also have had nurses and other staff on leaves of absence, which has added to our sort of vacancy burden, sort of an effective vacancy that isn't really counted when we calculate vacancies. So we've had to deal with shortages, but as an institution, we've been committed to keeping our staffing ratios where they need to be. And it's been a close call on some days and on some shifts. But for the most part, by hiring travel nurses and providing incentives for our staff to work additional shifts, we've been able to scrape by. It's been very tough, though. And, overall, Cedars has been a place historically that has a brand name and an academic medical center sort of environment where people want to work. And although our turnover has crept up, yesterday we had 107 nurses start in our new employee orientation. Half of those were experienced nurses and half were new graduate nurses entering our nurse residency program. So despite the fact that our turnover has crept up, we are able to hire a few nurses and sort of backfill those positions that we're using travel nurses and premium pay for our nurses to take an additional shift for.
Got it. Okay. Thank you for that overview, David. So let's dive into the topic of nurse retention first. And we have quite a lot of data from the Incredible Health platform about why nurses leave their jobs. When a nurse is creating a profile on the Incredible Health platform, we often ask, what are your reasons for why are you changing jobs? And we now have a database of close to 400,000 nurses. So roughly 10% of U.S. nurses are active on the Incredible Health platform. And so it's a pretty large sample size that we're talking here. And it really hasn't changed. COVID hasn't really changed their answers very much. So the number one most common reason why nurses are changing jobs and leaving their current employer is to advance their career. They're trying to increase their skills, they're trying to become more specialized, or they're trying to move up, to nurse management, or they're trying to look for cross-training opportunities. It could be a range of things, but for whatever it is, they're trying to somehow advance their career, and they're not able to do it at their current employer. The second most common reason is they're looking for a better schedule, a more flexible schedule, a schedule that enables them to have more balance. The biggest group of nurses today is millennials and Gen Z, and these are groups of nurses that are often caring for young children at home. They might have older parents that they're taking care of, where an inflexible schedule, for example, 12 hours a day, 3 days a week, or a night shift schedule may not be working for them, and therefore they need to find a better, just more flexibility. The third most common reason is something to do with geography, like they're trying to reduce their commute time, or they're actually relocating. So 1/3 of the nurses that are hired through the Incredible Health platform are actually relocating from different states. The Cedars-Sinai team uses our platform as well, and they've also taken huge advantage of nurses relocating to California and relocating to Southern California from other states as well. And so there is quite a lot of movement, geographic movement in the permanent labor market too. And then the fourth most common reason is compensation. Yeah, they're looking for a higher wage. I think when we are interacting with hospital executives across the country, they often jump to number 4 being the reason. And that's not actually of the 4, that's the least common reason. It's usually the top 3 that's the main culprit. So teams that are addressing these reasons internally tend to have better retention. And I know David's team has done a considerable amount of work in all 3, especially areas 1 and 2 and 4, and are really doing what they can to improve retention. And we'll go through that in detail. So let's dive in, David. Let's talk about career advancement, right? So we have a set of nurses that's looking to advance their careers, and we'd love to hear kind of your tactics and your strategies for making that happen.
Yeah, we've done our own surveys, and that didn't pop up number 1 on ours. Number 1 on ours was staffing that would allow uninterrupted breaks for our staff. That was the number 1 thing they wanted. And then the flexible scheduling popped up in there. And then I think pay always falls somewhere down the line. You
may have already tackled career advancement.
Well, I don't know if we've tackled it, but we've certainly invested a lot in it. Cedars, for the long term, has invested heavily in professional development. Starting with new graduate nurses, we have our nurse residency program that lasts a year. It's accredited through the American Nurses Credentialing Center's Practice Transition Accreditation Program. And that's really our first professional development step for nurses who come as new graduates. We've also invested heavily in tuition assistance and critical pipeline loans to allow nurses to advance their education. We think nurses need a robust professional development pathway for their career, and certainly made that investment. More than 90% of our nurses have a baccalaureate or higher degree, which eclipses most other organizations in the nation, even magnet organizations. And then more than 80% of our nurses are certified. So that investment has really put us in a good position to help our nurses with their professional development. We also look at developing our leaders at Cedars-Sinai, and we've had historically several programs that have put them on the right track if they're interested in a leadership sort of track in their careers. So we've had historically a Rising Star program where nurses who are ready to be charge nurses get training in advanced skills geared towards leadership. Really looking at that program now to sort of do, what Marshall Goldsmith talked about, what got you here won't get you there. Really making sure that it's equipping our nurses who take that program to get us to where we want to go in the future. We've also had emerging leader programs developed with our organizational training and development staff, really to capture the attention of those who think leadership is in their future, and to give them some tools to help them figure that out and to be better leaders. I've always said that every nurse is a leader, and I've heard that in my entire career. So whatever skills they gain as a leader, it helps them in their job. And then we have specialty training programs in critical care, emergency, labor and delivery, and perioperative services. So if you want to stay at Cedars and you don't like the area that you're working in, you can choose one of those areas and go into an internship and work on gaining the basic competencies to be a skilled professional in those areas. So those are some of the things that we do at Cedars to invest in the professional development of our staff. And that's not only nurses, we do that for others. I can't tell you how many times I've made rounds and talked to a nurse practitioner who started at Cedars as a executive assistant and is now got their master's and is one of our nurse practitioners. So success stories like that abound at Cedars-Sinai.
Okay, so you and your leadership team have made a conscious decision to invest heavily in development, career development for nurses. Can you share why? Like what's the rationale behind making these investments?
It's an investment in making people more loyal to the organization, I think, at its core. if we invest in their development, they tend to stay. And, that's served us well over time. Is that going to serve us well for the future? I think that remains to be seen, but we're going to continue to make that investment. We know that we're going to need strong leaders in the future, and that we know that developing them internally is probably the best course of action. We know that it's difficult to recruit nurses, so as many nurses as we can get into our nurse residency programs, it's important for us, sort of to grow our own, to refill the ranks of those who may be retiring in the future. But those are some of the reasons the investments are so important. And I think I just got off our 2023 budget planning call, and that's, we're going to double down on those efforts and continue to help these people who haven't even, understood the context of the last 2 years. We're going to help them develop professionally. We're going to help them heal, and we're going to help them move forward. So I think the investment is only going to continue.
Got it. So you've also created a culture of excellence, and I know that your team invests heavily in nurse research. Can you share a little bit more about that?
Yeah, I'm very proud of the legacy of nursing research at Cedars-Sinai. Really, I think my predecessor, Linda Burns-Bolton, who's a luminary in nursing and nursing leadership, really set Cedars-Sinai on that course. We have a Office of Nursing Research in our Nursing Institute. We have an endowed Nursing Institute that houses education, innovation, and research. Our research team is composed, I think, of currently 4 PhD-prepared individuals, 2 PhD-prepared nurses, and 2 PhD-prepared researchers who aren't nurses. But really, those nurse scientists run that department, really help our clinical nurses solve the questions that they ask. We're very proud that they recently, in the last year, earned a PCORI grant, a very prestigious PCORI grant. We don't think there are many hospital-based nursing services that have a research department that has garnered a PCORI grant, but they're really looking at how to preserve the independence of elders so that they can remain in their homes. Very proud that that's our focus. We serve at Cedars-Sinai more individuals over the age of 80 than any other academic medical center in the nation. And that's confirmed with data from Vizient, which is a national consortium of academic medical centers. So focusing on keeping those people in their homes as long as possible is important for our community, and something that I'm very proud that they got that grant for. We are very lucky at Cedars to have a few endowments that support nursing. We have, I mentioned before, the Nursing Institute that's endowed by Jerry and Richard Browerman. The Browerman Institute provides a lot of the funding for many of the educational efforts that we do, that we talked about the investments earlier, but the organization also supports those. We have 2 chairs of nursing, one that I sit in, the chair that I sit in was endowed by a physician who was at Cedars-Sinai who passed away, and his family set up that chair. It was previously, the inaugural holder was Linda Burns-Bolton. And then since I've been here, we got another chair endowed. That's for our chair, for the Sims-Mann Chair for Nursing Education, Research, and Innovation. So we're well positioned to use the funding that spins off from those investments made by our very wonderful donors to help support the efforts at education, research, and innovation at Cedars-Sinai.
Okay, got it. And then we know that even at UTMB, you're dedicated to nurse innovation as well. Are you able to just share a couple quick examples of you supporting nurse technology and innovation, and really what role that plays in nurse retention too?
Yeah, I say that wherever there's a nurse, there's an idea about how to make either themselves more effective, their patients more comfortable, or the environment safer. And so I got the chance at UTMB to work with a group of researchers from the Massachusetts Institute of Technology. They had a grant from Robert Wood Johnson Foundation. Really, they had been to South America. They wanted to see how South American physicians used whatever was in at their hands to make devices to help them provide care for patients. What they found was that it was nurses in South America that were using things in the supply closet to care for their patients. And they wanted to come back to the U.S. to see if that held true here. And so they had this idea of opening a makerspace, a space where nurses and others from the healthcare team can go and prototype devices or prototype items using 3D printers, laser cutters, sewing machines, Velcro, any type of hardware. And so we opened the first makerspace in a hospital in the U.S. at UTMB in Galveston. And nurses would come in and really talk about problems in their daily work. And really, the engineers were available from MIT initially over Skype or what were, before the pandemic, those systems that we used to communicate over distances like that with voice and video. And we talk about their problems and then talk about solutions. I think, lots of nurses have those ideas, but they're fleeting sometimes. So having a space that reminds you that your ideas could generate something that would help others, it creates a sort of an environment where people want to go and share their ideas. So a couple examples that came out of that. One, we had a nurse who was a new nurse in the cardiac cath lab. She was going through orientation. They were using the radial artery approach for cardiac cath, and she was taught to prop the arm up on a stack of towels. And she thought there's got to be a better way. So she designed a positioning device for the arm so that it would hold the radial artery in position. And then another simple pain point that a nurse solved, we opened a new patient care tower and outfitted it with new patient recliners. And in the ICUs, this nurse found herself stepping over the patient's urinary drainage bag and to get to the patient. And the chairs didn't have a place to hang the bag. So she went into the space and bent some clear plastic and outfitted it with Velcro and attached it to the chair, and it became a place for the urinary drainage bag to hang. So a couple of the things that came out of that.
Okay, great. So this is a photo of the Moxie Robot, and I know that the Moxie's become a member of the Cedars-Sinai team, and it's helping nurses. It's delivering items to nurses, right, to shorten their wait times.
Yeah. This is a great picture. Moxie, we have 4 Moxie in-house now as part of a pilot to see if it can benefit our nurses by giving them time to stay at the bedside. That's another thing that our nurses said in the survey that we did, is we need to be able to spend more time with our patients. So freeing them up from tasks like leaving the unit to retrieve an item or sending their care partner off the unit to retrieve an item, keeping them there is important. So Moxie is helping us do that. It's, I think, saved over 1 million steps. And I think the delivery time for some items has decreased almost 4 times, from 2 hours to 30 minutes. And our nurses have gotten a positive emotional response just from the heart eyes that you can see on the robot and the little chirps that it makes. So it's been it's something that came through the Cedars-Sinai Accelerator, where Cedars-Sinai brings in cohorts of startup companies every year and really gives them the advantage of the advice of all the medical expertise and the nursing expertise and pharmacist expertise and therapist expertise at Cedars-Sinai to help their startup companies. And then we try to use their products to solve pain points in our environments. So that's how we started with Moxie.
Great. All right, so let's transition to what your team has done to build a positive workplace. And one of the things that comes up very often in conversations with nurses as they're looking for new roles is that they want to work somewhere where they feel heard and where it's a positive environment, right? And a positive culture. Like how do you define that? And how did you make that happen at Cedars-Sinai?
Well, I think listening to your nurses is important to defining what the positive culture is. So finding out what's on their minds, what's bothering them. The survey that I mentioned is one way that we've used. We've also, and maybe we'll have some time to talk about it later, but have revamped our shared governance program. And over the past year, even during the pandemic, really doubled down on shared leadership councils and bringing them together virtually over the past year, but also a couple of opportunities to bring them together in person in between surges, but really to address their issues. We have a CARES form process where they can online submit questions that they have about issues at Cedars-Sinai, and those come to the leaders weekly, and we look through them and see how we might either place them in the organization in other places or take care of them on our own. So it's, listening to our nurses, I think, help us define what the positive culture should be. And, before it did happen before I got here, but device integration is much further along at Cedars-Sinai than it was where I came from at UTMB. I think there's very little that's not integrated. So, automatic documentation from electronic devices into the medical record, for instance, vital signs, which happen around the clock in hospitals, that information gets populated automatically into the medical record and just has to be verified. So lots of saving clicks and things in the medical record is an important task for us, really, to get our nurses that time back to care for patients that they ask for. So we work closely with our enterprise information system team and making those sorts of changes that impact the nurses' practice.
Yep. And so I know your team also offers spiritual and counseling services, because you're taking care of the whole person, right? The whole nurse. And then the other thing is that you have income protection. There was no pandemic layoffs. Could you share a little bit more about sort of the paid protection programs and your shared governance as well?
Yeah. So early in the pandemic, Cedars-Sinai, before it even was a state sort of requirement, decided that it was going to protect the pay of its employees who couldn't work because of the pandemic, either because our volume had gone away or they were working from home. But we also stood up what we called an employee resource bank. So if you could, you were asked to continue to work, and we deployed people across the organization to support patient care through that. But really was so proud to be part of an organization who had the forethought to sort of say, we're going to keep our employees whole in what we thought was going to be a short pandemic at that time, right? And who knows when it's going to end. When we were able to open back up and people were really able to work from home, and we were continuing to not close because of the surges as we did in the first sort of surge, people had to come to work to get paid, or work from home to get paid. So then recently in the Omicron surge, the state put back in the process of having to cover for those who are ill from COVID or tested positive from COVID. So Cedars has supported that. You talked about spiritual care. Cedars is a sort of a faith-based organization. It's a Jewish faith-based organization. I'm not Jewish, but many of the principles of Judaism really resonated to me when I came to Cedars. And since their founding, one of their principles has been to be a blessing as an organization. That really captured my attention. And today, Cedars has a robust spiritual care department that has over 30 different religions, chaplains in it, and they make rounds, not only on patients, but on our staff. And I frequently see them, when I'm on rounds, engaged in conversations with our staff. And I'm lucky to be on a committee looking at how we can improve our spiritual care services, and recently did a survey, and nurses were the #1 respondents to the survey about spiritual care at Cedars, and really about their use of it for their own well-being. And I think that's so important for us to continue to support.
Okay, got it. So the topic that everybody wants to know about is compensation, right? Because we've all been seeing wage inflation over the last 2 years, and it's expected to continue for several years to come. Can you share with us your philosophy about how you think about compensation for nurses, particularly your permanent nurses?
Yeah, Cedars takes the ability to recruit in a very competitive market very seriously. So even before the pandemic, did market compensation surveys at least twice a year to make sure that our salaries were either leading the market or very competitive with the market. That has continued throughout the pandemic, and over the past year, we've done many equity increases to make sure that people are at the salary level that they should be. We don't want them to leave the organization for $1 or $2 an hour across town at a similar brand recognized academic medical center. So really staying competitive in that way is important. I think all the total benefits, when you add them all up, including those resources for education that we talked about earlier, professional development, really give them a total rewards package that they probably don't realize what they're getting when you add the benefits, life insurance, health insurance, those things, retirement. It's a heavy investment for the organization, but every organization makes those investments in their employees. And Cedars is committed to continuing to pay competitively and to keep people here with competitive wages.
Great. And yeah, and we know you do differentials for shifts, but you also have a float pool, right? Which you're essentially providing more higher salary for the float pool in exchange for more flexibility too.
Yeah, if they can float to 3 areas, they may make more than somebody who can float to 1 area or 2 areas. So yeah, a common practice across the industry is those internal float pools and really trying to match, capacity to demand sort of thing.
Yep. We even work with teams that are creating their own internal travel agency. That's what they coined it. And you are it's essentially like an extension of a float pool, honestly. So it's even more pay than a float pool, but you have to have complete flexibility, like to go to any location, any unit, and that's one way they're combating, the competition with the travel agencies too.
Yeah, at some point I'd love to talk to you about that.
Yeah, definitely. So then the other thing your team has done is just providing more flexibility, and I'd love to hear a little bit more about that and how you think about that.
Well, it's different shift options have been available over the past few months for people to come in. And, I said on that survey that people wanted time for unlimited breaks. Well, bringing in break relief at maybe 11 instead of coming in at 7 and supplementing. In California, the staffing ratio mandates require that you maintain those ratios at all times. So even when a nurse goes on break, they can't just ask their coworker to watch their patients. We have to have someone there to maintain the ratio. So bringing in people at odd hours has been one way that we've given people some flexibility. Nurses near retirement, we looked at an emeritus nurse program a little over right before the pandemic started, really seeing to how those nurses who recently retired could come back into the workforce and contribute, either educating or holding the hands of those new nurse graduates. So we hire into the residency program and sort of guiding them through their first year of professional nursing out of school, really trying to ease that transition. And then flexibility across, if you want to work certain days because your husband has those days off and he can be with your children. We try to have our associate directors, who are our nurse managers at Cedars, really look at those things and try to accommodate them as much as possible to give our nurses that flexibility they've asked for. Is it enough? It's probably not. And we need to explore how to incorporate 4-hour, 6-hour, 8-hour shifts into what has traditionally been a 12-hour shift workplace, and that was the only shift option you had. But the flexibility has been called for, and we're exploring other ways to make it happen. Can we allow nurses to go work 3 months in a call center and get away from the acute care or critical care bedside for a few months and then come back and let somebody else do it? Those are the things we're trying to explore, and hopefully can find ways to do that in the near future.
Yeah, we work with over 500 hospitals and health systems across the country in 25 states, and the teams that our data shows, the teams that offer more flexibility end up hiring more as well. So the more part-time options that are offered, the more, encouraging nursing leaders to not be too, so strict about the 3 days a week, 12-hour shift. There has to be other options available.
Yeah, there's geographic contexts in LA that make it nurses prefer to work 12-hour shifts, so that they only have to drive great distances to get to the medical center 3 days a week.
3 days a week, yep.
So, many of them prefer it, and, trying to do what the majority want and then meeting the flexibility needs of the few who ask for it is, I think, our challenge.
Right. So one topic of controversy that often comes up in different hospitals is the nurses with more tenure get the day shifts, right? And it's like the new nurses have to take the night shift. I'm curious how you've dealt with this sort of dynamic. Of course, it makes it more challenging to hire experienced nurses because they want the preferred shifts. How have you kind of thought about, the fairness of scheduling when it comes to your nurses?
Yeah, letting them know up front what shift they're going to work is the way our associate directors have handled hiring. So up front what shift you're being hired for, what the potential is for you to move to a different shift in the future. And that has seemed like the way to honor the service of those who's been here a number of years, who want to pick their shifts, whether it be night shift or day shift. And then we hire to fill the positions that aren't filled by them. And up front where you're going to be, and what the opportunities are going to be in the future for you to move to a different shift if you desire to do that. And the float pool that we have internally is another option for people who want some flexibility, both in shifts and units worked. So those are a couple of the options that we have.
Got it. Okay. All right. So let's shift over to nurse hiring. I think we're getting a lot of questions about hiring. So let's spend some time on that. So I think one of the unique things, we work with, the Incredible Health team works with the Cedars-Sinai team, and one of the unique things that you have is your strong partnership between nursing and HR. That actually doesn't always happen, okay? Like, just to be honest, like sometimes there's more tension than there should be between nursing and HR, finger pointing, et cetera. We know that you have a really, really strong relationship with your HR team. Can you share a little bit more about the collaboration between the two leaders and the two teams?
Yeah, it was something that existed before I came here, and it was really refreshing to see. I've been at Cedars for 2.5 years, and I think the relationship has only grown stronger. I serve on the sort of medical center executive team with the senior vice president of HR. So we're members of a team together, and then we have members of the Cedars-Sinai nursing recruitment team. I think people that you work with through the Incredible Health contract, Brian Hickey and his team, Nancy Figueroa, those guys, we work with them. They come to our nursing leadership meetings routinely. We consider them part of the team that helps us meet our hiring needs at the bedside and throughout the organization. And they hear us talk about what's going on in nursing, what our needs are. They have suggestions. We have suggestions. They listen to our suggestions. We listen to their suggestions. And, it's gotten to the point where if you don't act on a client at first contact, that you're not going to recruit. You're not going to get that recruit. So they sort of expect Amazon Prime type delivery of an interview. So most of our associate directors now allow Brian and his team to directly place candidates on their calendar for interview and know to make that time a priority. But Cedars is a very relationship-based place. It's just part of its nature. And, that relationship that exists with HR and nursing also exists with information services in nursing and every other department that nursing interfaces with. That strong relationship is cherished and nurtured, and I think it makes everyone feel like they're part of the direct care team or part of the nursing team.
Yep. All right, so let's talk about streamlining nurse hiring, because it is an area that many teams struggle with across the country. Our data shows that in every market that we're in, including the LA market, the Dallas market, it doesn't even matter what the geography is. There's multiple competitors that are competing for talent. We have some teams that have really big brands. We have some teams that have very high compensation. And then we have some teams that have very fast internal hiring processes. And we see time and time again, it's the teams with the most streamlined and the fastest internal hiring processes that end up hiring the most. It does speak, it's the reason is around, what you described as Amazon Prime level service that the candidates and the nurses are expecting. And, there's just like an intense amount of competition for the talent as well. What have you done, particularly at the hiring manager stage, to kind of accelerate that piece as well, the piece that the nurse managers are really overseeing as well?
Well, talk ourselves till we're blue in the face. That if they're not showing interest in someone, we're gonna lose them. We need to anticipate the questions that candidates are going to have and be responsive to them. And it really is that first contact. They get contact with a hiring manager, and really trying to drive that home. Is we're not going to meet our staffing needs if we don't have that sort of mentality. So I think that's been sort of the mandate that we've had, is that that first contact, you got to grab onto them and make sure that they understand you want them.
Got it. And you cited the example earlier of allowing your talent acquisition team, Brian Hickey's team, to schedule directly on the hiring manager's calendar.
Right.
And that's a newer thing. It wasn't the case at all a few years ago. What was it that essentially convinced your nursing managers to allow that? Is it primarily about the speed, or? I
think it was that message that if we don't do that, we're not going to get the candidates.
Yep.
So, they're open to trying things out. They're very trusting, and if they don't get burned by something and it works out, then they continue to do it. So it's worked out, I think, for the best.
Okay, great. So we are getting a few questions about new graduates, right? And so I know that your team does heavily invest in new graduate hiring and new graduate training. Would you mind just sharing us a little bit more about hiring of new grads as well as a nurse residency program?
Yeah, the new graduate supply is great. I think we're able to take up to 50 new graduates every quarter. So there's stiff competition for those positions. I think we get about 300 or more applications for those 50 positions every quarter. So if there were ways that we could create unlimited preceptors and unlimited spots for those new graduates, we would be in a really good position. But we also want to balance between, you hear people talk about the complexity experience gap as the complexity of our patients increase. There's a gap between having to hire so many new graduates. So we try to balance that, and that's one of the reasons that we limit it to 50, but it's also the resources to bring new graduates into the organization successfully, which requires preceptors, nursing professional development specialists, really to guide them through that 1-year residency, where they get in-person didactic training or development that really builds upon what they learned in their undergraduate program or their basic preparation program. Cedars historically hasn't hired anything but baccalaureate or higher graduates. But over the past year, we sort of said, is that the right thing to do in the current environment that we're in? So we have opened up to a few associate degree nurses, mostly those who have been our nursing assistants or what we call clinical partners in the past, who've gone through school while they're working for us. So we have brought some of them in. We, of course, have made them aware that we will invest in them and assist them in achieving a higher degree when they're ready. But I don't think it would be good to have an entire workforce that's composed of new graduates. We have a very good record of safety and quality at Cedars, and that includes good catches or avoiding near misses. And I think that calls for an experienced eye, and it's hard to train for that experience. So having a balance is very important for us too.
Yep. Okay, fantastic. So next, we'll just do a quick overview of what it is Incredible Health is and what it does. We know you're Brian Hickey, your executive director of talent acquisition, oversees a very robust talent acquisition strategy. It includes events. It includes he has a fantastic team as well, and they were early adopters of the Incredible Health platform because we had started in California. I'll share a little bit more about what it is that we do, how we work with the Cedars-Sinai team, and then we'll turn over to Q&A. So Incredible Health, it's a marketplace. It's a career marketplace for healthcare workers, and hospitals and health systems use our custom matching technology to hire high-quality permanent nurses in less than 20 days. Our platform average right now is about 16 days, and so that's our claim to fame. You can hire permanent nurses quickly using our platform. We already work with over 500 hospitals and health systems across the country. including big ones like Kaiser Permanente and HCA. We work with many academic medical centers, including Stanford and Cedars-Sinai and Johns Hopkins, and many community hospitals across the country as well. And so this is I guess, a tried and true platform at this point, and it's been really great working with Brian's team on it as well. So as far as like what we do, first, the employers are applying to the talent instead of the other way around. So this is a very nurse-centric platform. And a lot of what we've been discussing, David, is how do we make our nurse retention strategies and our nurse hiring tactics to be more nurse-centric at the end of the day. We do really need to meet them where they are. And that's the unique thing about our platform. The employers are applying to the nurses, not waiting for nurses to apply to them. We've also automated the screening of the talent, so we're able to serve up high-quality supply. And we do custom matching. So for every employer that we work with, we build custom matching algorithms. The Cedars-Sinai team, for example, has very specific requirements that they need, right? There's BSN requirements, there's certain years of experience that they need, there's certain specialties they need, and that is what it is important that we are matching the correct nurses that are most appropriate for Cedars-Sinai, as opposed to just, throwing everything that sticks, right? And then we also
created
provide
a profile on integrated health just to see what it was about.
Oh, great. That's awesome. And hopefully you got pinged by our screening team in case you're looking for a CNO role. We know you're not. And then we also provide data analytics. So the teams are able to see like how are candidates progressing in their process. How many days is it taking from each for nurses to get through each step, and where are the drop-offs happening? For example, we did have more drop-offs than we would have liked at the hiring manager stage. And a lot of that had to do with what you were referencing earlier, David, about scheduling, right? Like we were losing talent because we weren't scheduling hiring manager interviews fast enough. That was clearly shown in the data, and that's something that a nursing leader like yourself or an HR leader can take to hiring managers and sort of adjust processes to address that issue. We also provide a whole range of free tools and services to nurses. That is really how we attract nurses to our platform. We offer free continuing education to every single nurse. There's free salary estimators. There's an advice platform for nurses built into our apps. And this attracts tens of thousands of nurses to our platform, and a portion of those use our hiring product as well. So a little bit of data that I just want to share with everyone. I know we have, over 600 attendees on this webinar right now. 68% of nurses accept the very first offer they receive. So speed is really of the essence. First to offer is a huge advantage when you can do that in a competitive market. And then 61% of the nurses are accepting their first offer, even if the second or third offer ends up having higher compensation. Again, I mean, like searching for a job is not the most fun experience, to be honest, especially when you're already working full time and you're being overworked and you just want to be done quickly. And the teams that are able to get the process done quickly tend to win. This is just a case study from one of our clients. This happens to be an LA client. These are different steps in the hiring process, and you can see that where we have the biggest impact is on time to source, really getting that down from 44 days down to 3 days. Yes, we do shave off days later in the process through things like automated interview scheduling and things like that. But we're really, for this team, trying to get the days to fill down from 66 days down to 19 days, and that's what we'd achieved for them, and that's what we want to achieve for many of the employers that we work with. It ends up offsetting the costs, the travel nurse costs and overtime costs. So that's why another reason nursing and HR leaders love this platform, because it's about cost savings as well. All right, and then retention. We're always asked about retention. So when we track we have quite a lot of data on our 1-year retention. So 12 months after a start date, the nurse retention is 15% higher than the health system's baseline. The reason for that is because the nurse was able to consider multiple opportunities before selecting that employer. Let's take the LA market as an example, where we work with a lot of teams. If you are a highly sought after OR nurse, ICU nurse, et cetera, you may be speaking with Cedars-Sinai and UCLA and USC and Kaiser Permanente and so on. I mean, David, you operate in a really competitive market with a lot of hospitals. And the nurse is able to go through multiple processes, and when selecting Cedars-Sinai, it was a very well thought out approach, and they were able to see what else was out there as well, and that's yielding higher retention for your teams. This is how we partner. So these are the This is a true collaboration. It's a true partnership. Incredible Health is taking care of the first 4 steps of the hiring process, sourcing them, pre-screening them, making sure they're actively looking and getting that first phone screen scheduled with the recruiters. At that point, the Cedars-Sinai recruiting team is completing their phone screens, getting hiring manager interviews scheduled, and getting offers out. So we have to work together in order to make hires happen. And it's a true collaboration, a true partnership. This is a new model in talent acquisition where we, in the same way, David, you talk about ensuring that you save nurses time and you want them to be operating at the top of their license. Recruiting teams also need to be operating at the top of their skill set. And so, using automation like Incredible Health to take care of things like sourcing and screening, which are highly administrative tasks and repetitive tasks, to free up recruiter time to spend that time with talking to candidates and building those relationships and building the relationships with their hiring managers is critical, especially as more and more pressure, the pressure increases on the nurse recruiters to fill more and more roles. So we really do need to think about the recruiter, how they're spending their time, and ensuring that we're able to take some tasks off of their plate too using technology. All right. Just this is some data that we got permission to share about Cedars-Sinai specifically. 83% of the nurses that the Cedars-Sinai team has sourced through Incredible Health accepts their Cedars-Sinai offer. A lot of that is kudos to David's efforts around maintaining great compensation and just being a great employer and a great place to work. And 86% of the nurses hired that Cedars-Sinai has hired through the Incredible Health platform have been in hard-to-fill areas, including the ER, the OR, neuro, the cath lab, et cetera. All right, so let's open it up for questions. We've got about 8 minutes left, and we want to get through as many questions as we can. So I'll just go ahead, Gabriel. Go ahead.
Definitely. Thank you, Mon, and thank you, David, for your great presentation. We do have so many questions. But if anyone else in the audience has any more, you can submit any questions by typing it into the Q&A chat box on your webinar console. So let's get started with the first question here. One audience member wants to know, how do you accelerate the hiring process when the initial nursing manager that interviews passes on the candidate, but they may be a fit elsewhere?
Is that a question could you repeat that question again? Sorry.
Yeah, definitely. How do you accelerate the hiring process when the initial nursing manager that interviews passes on the candidate, but they may be a fit elsewhere?
Great question. I'm happy to answer that one. I know that the Cedars team takes advantage of this tactic as well. It is really important that nurses are pursuing multiple opportunities at your hospital and health system at any given time. So, there are many nurses that are qualified for multiple specialties, and so they can go through multiple hiring processes with different hiring managers. So what that does is that, let's say, one of the processes doesn't work out or one hiring manager passes, it's important that there's other processes that are happening at the same time. Ultimately, we need to make sure that the nurse ends up at your health system, or like say Cedars-Sinai, then the competition. And one way to do that is to increase the number of opportunities. The other data that I wanted to share is that when nurses have at least three interview requests from a specific health system, the probability of them being hired at that health system goes up by up to 80%, 80-90% probability that they're going to get hired at that health system because they've been given multiple opportunities to pursue.
Great, thank you so much. Another audience member would like to know, for nurse recruitment, does the health system team or the Incredible Health team manage the efforts, paid advertisements, et cetera, to drive nurses in the health system's geography to create Incredible Health profiles?
Great question. It's both, really. So we are a tool in the health system's toolkit at the end of the day. They often have a budget already dedicated to marketing and so on, but by using Incredible Health, it's just adding a little bit more fuel to the fire, right? So we are really increasing the amount of talent supply that we're driving to the team. We do take advantage of opportunities like co-marketing, and I know the Cedars-Sinai team has taken advantage of this too, where when we're advertising as both Incredible Health and Cedars-Sinai together on one ad, that actually really accelerates the talent supply and the number of nurses that are applying.
Definitely. And I know this question is a hot topic right now, but one audience member is curious about any thoughts regarding the national conversation related to capping travel nurse rates.
David, I'll let you take that one.
Yeah.
Take the hard questions.
It's sort of a market-driven sort of thing, and I feel like maybe I've been part of the feeding the beast, so to speak, because we needed people to take care of our patients, and we paid what we needed to get them. And capping might be a good idea. I don't know how that would work with restraint of trade and those sorts of things, or whether it would be even feasible under the Constitution. But yeah, it's a tough question, and I don't exactly know how to take a stand on that. I understand why people would want it capped, but I'm not sure it's possible or feasible. And then, it's like I said, the demand has really driven the increase, I think, in rates that we're paying, and those who could pay for it did across the nation, and unfortunately fed that beast. And I don't know if you have thoughts, Aman.
Yeah. Couple quick thoughts. I mean, look, with Incredible Health, we only focus on permanent nurses. So like we don't play a role at all with travel and temporary workers. I guess my personal opinion on it is I think it's a little bit short-sighted, trying to pass legislation that put caps on nurse pay, because as we've talked about in the last hour, right, like it's important that a health system has long-term strategies in place for nurse retention and for nurse hiring. And at the end of the day, it's not like wage inflation is going to go away. It's the laws of supply and demand, and it's important that leaders implement long-term strategies like many of the ones that David described in order to make sure they're as an employer, you're a great place to work, and that you've got tactics in place to drive retention and to drive more rapid hiring too.
Thank you both for your thoughts on that question. We have so many questions. We'll try to squeeze in a few more. One audience member wants to know a little bit more about the thank you bonus. Does everyone get the same amount of money, or is it merit-based?
What bonus again?
The thank you annual bonus. Yeah.
Oh, I think, the thank you bonus, everybody got the same amount this past year. So I don't remember what the amount was, but it was across the organization, an investment, and everybody got the same amount.
For those of you that have additional questions, like feel free to send it to us over email. We've shown the email here on the slide, and either David or I will try to get back to you as well, because I know there's 40 questions have been submitted, and we're not going to get to all of them.
Yes, and you both will get all the questions as well. Yes, let's do one more. Iman, you mentioned some health systems are starting to create their own travel agency within their hospitals. Can you expand a little more about that and maybe the benefit to the health system and thinking behind that?
Yeah, absolutely. They're calling it, different names depending on the health system, but essentially it's an internal travel agency. So the nurses are the employees of the health system, and they are being paid higher wages in exchange for flexibility. And when we say flexibility, it means that the nurses has to be willing to work at any location, any shift, and in some cases, any unit as well. It's beneficial to the health system because, of course, they're not paying the administrative fees that are normally going to an external travel agency, and essentially they're sort of focusing the wage on just on the fees that they're collecting. Excuse me, they're focusing the money on the nurse instead of giving it to an external travel agency, and so it's been an effective strategy in many states. We've seen it implemented with hospitals in Pennsylvania and Florida, also in California. And it is a way to combat travel agencies. And it's great messaging for the nurses too. Like for the nurses that are considering leaving for a travel role, be like, you know what? We have our own internal travel roles. Here you go. It's going to match the pay that you're going to get with a travel agency, and you can stay in the health system.
Well, Thank you. And unfortunately, that is all the time we have today, but we'll make sure all questions get into the right hands, and Iman and David will be sure to follow up. I want to thank you both for such an excellent presentation and incredible help for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you again for joining us, and we hope you have a wonderful afternoon.
All right. Thanks, everyone. Thank you, David. Appreciate your time as well.
Nice to be with you, Mom.